General, I have one question, and again, I was as impressed with the change in conditions in southern Afghanistan, particularly in the area where the Marines, where we were wondering were they going to be able to take it back. But one of the we heard a very moving story about an IED attack on one of the units, and I guess it was the convoy commander that got hit the hardest on there. But clearly, one of the big issues, which also affects the Army, is the traumatic brain injury. Can you address specifically, in terms of the Marine Corps, the kinds of programs or what you're doing to address TBI?
Congressman, I'd be happy to. This has been evolutionary, and I know that you're close to General Corelli. And when I was the Assistant Commandant of the Marine Corps, we worked for, both General Corelli and I worked for 2 years in earnest, trying to capitalize on the latest technology as far as being able to determine what is traumatic brain injury, what is it, what are the effects of that on that mass inside that skull. We have come a long ways since 2003 when quite honestly, nobody was even talking about TBI. In a nutshell today, we recognize it, we understand some of it, we don't understand all of it. We've taken lessons learned from the National Football League, worked very closely with University of California, Los Angeles, the head of the traumatic brain injury out there, Dr. David Hovda, and using that as and bringing in great minds across the country that understand this. We built about 2 years ago, about a year and a half ago, what we call a concussive protocol. And what that means is recognition, first of all, that a concussive event of any kind that either knocks a Marine down, perhaps, or throws him up against a wall, or worse yet, he's standing 5 meters away from his buddy that steps on a pressure-plated IED that goes off. All that has a great effect on the brain. Each brain is different. It's affected different. So what we've done now using this protocol is we've brought every single Marine, and it's happened to every single soldier now that this happens to in Afghanistan. You enter this protocol. In other words, you have the event, it's registered, you come back to your combat outpost, forward operating base, wherever you are. You see the corpsman, medic in the case of the Army. The next person is the doctor, if there's one available. Depending on the extent of the injuries, we will fly our Marines from our forward operating base, our combat outpost, into Leatherneck. And they start this procedure where we do an exam of the head, there's a physical examination, and then there is a cognitive test, a series of cognitive tests over days. And depending on whether you were knocked out, depending on how you feel, depending on how you look with regards to the examination, dictates what the next step is. But in a nutshell, this is what we've discovered is the brain needs to be rested after a concussive event. The very best thing you can do is take the brain and put it at rest. In that case, it's keep it in the combat outpost, keep it at the forward operating base, or fly it back to a resuscitative, not a resuscitative, but a care unit, which we've established at the Leatherneck. And then depending on how long you were knocked out or how severe it is, dictates how long it is before you go outside the wire again. You could conceivably never leave what we call the wire of the combat outpost again. In our case, we have what's known as 3 strikes you're in, which means on the 3rd concussive event, you're not going anywhere. You're not going out on patrol anymore. You're not leaving the wire. So these are the things we're doing. We've set up the organization at Leatherneck, which examines Marines and helps them with the rehabilitation. And the final thing, Congressman, is that we're in the process now of deploying an MRI into Camp Leatherneck. That should happen this year, and that will then give the local folks an opportunity to examine the brain and then send that information digitally back to the United States of America for analysis. So great recognition, it's real. We're doing something about it. I think the concussive protocol will probably save mental lives down the road, yet to be seen.
Thank you.